All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So this is a chit chat, but it is through OBS. So again, if the audio is not working correctly or there is an issue with the drawings, my apologies in advance. Within a couple of days, we'll figure it out. And I would also improve on the Photoshop side with drawings as well. Okay, so let's start. Roller Girl is here. Hello. Dr. Z is here. Hello. Kelly says Dr. Bean's probably still figuring out the new streaming tools as he has to work with Rumble. Yes. Or with Odyssey. So yes, I'm working with these tools. It is actually fun to figure them out, but of course there can be chances of glitches and issues. Good evening, Christine. Kelly. Tex says, hello, how are you? I was reading your comments, Tex says that we will not have moderators on Odyssey. I did not know. So we'll ask them. Chilly here, Christy says, chilly here in Florida, getting down to 72 tonight. Famous Doug, is he here? Hang in there, Famous Doug. Here's a cookie. So Doug wants cookie. It's been 5 minutes. So sorry, Doug. I just wanted to take a quick break. Very good study, Samina says. Thank you very much, Samina. I hope you're doing okay. How are things there in Bangladesh? Actually, in your honor, let's look at Bangladesh. Okay, so I'm going to, give me 1 second. I'm going to go to my browser. So my apologies that my keyboard, mouse, they make noises. I will change them soon. For the time being, they are this way. Okay, so I'm gonna share my screen, going to OBS. Okay. So this is, so my video is there, that is good. Comment is here. This is OBS screen, sharing the screen. I'm so happy like a little child. So here we are. If I can close this. Did you notice that Worldometer has put so many ads everywhere now? They are making money. Okay, so Bangladesh here. Alexa, what is Bangladesh's population?
In 2020, the population of Bangladesh was 165 million people.
So 165 million people, that's a large population. Bangladesh and 1.5 million cases, 27,000 deaths. That is a pretty good control over the disease. Of course, every death is unfortunate. It's difficult on the families. It leaves a mark forever. So, Samina, Bangladesh is quite much in control. What was so starting from May, it started going up. May, June, July, August, September. So that 4-month cycle. And number of deaths are also following that. So good outcome in Bangladesh. Samina, do you know what are the standard protocols at this time in Bangladesh? Christine says, yes, tons of Worldometer ads. Yes, there are so many ads on Worldometer. It's full of ads now. Art Patron says, Borodi protocol used. Don't know. Let's see if Samina can tell us. Okay, I'm going to see if there are other questions. So John Titer says, any new studies or info regarding why people have long-lasting neurological symptoms after getting vaccinated? So this is actually happening after COVID as well. The neurological symptoms are just continuing for a long time. So I can tell you the internal discussions that some of the doctors are having, including Dr. Yo and then Dr. Bruce. I had some discussions via email with Dr. Bruce. Dr. Patterson, he said more than so he still is thinking that it is the S1 subunit sitting in the monocyte, and then monocyte patrolling the um, blood vessels, causing inflammation in the local tissue. And he said that Maraviroc has been working magically. So that is an interesting comment. I am seeing other, for example, there is a patient who is in my family. Um, she, my wife's family, she had vaccine, she had infection, then she had vaccine, and then she developed neurological symptoms, severe neurological symptoms, to the point that sometimes she could not even get out of her bed. 25, 26 years old, so young woman. And her doctor prescribed her naltrexone, and within 2 to 3 days she is much better. She is now doing her function. She's a software engineer, so she's now working on her job and so on. So that is a very interesting thing. So again, your question that do we have new studies in Discord, there's a cool bean John. He had shared some studies with me. I have not gone over them. So John, I would go over them and I'll discuss. Your name is John as well. So Pasi says, still don't see the new shows on Odyssey. So Pasi, for Odyssey, I had to first set up this OBS. And so today what I did was I created the least resistance for myself. And that is number one, new drawing software, Photoshop, usage of OBS, but without going live on Odyssey. And I went live to this current system so I could at least understand how does this all work. And now I'm going to try maybe tomorrow, day after, or maybe I'll not tell you and sneak in as a live talk on Odyssey just testing. So still working. This whole thing is work in progress now. So same answer, Jody. First, I wanted to understand the setup, that how will this work? And now there is a requirement on Odyssey side. Their tech team told me that we could not relay at a higher bit rate. So we have to relay with the lower quality. I think 720p is what they allow. So I have to now figure out that if it is 720p, how would that work? So there are a bunch of things I need to test before we become. And then it turns out that YouTube has this notification. I could go live half an hour before and still not be live. And so kind of a pre-show. Odyssey has no such thing. And I think they do not have the notifications yet. So the way for any of us to figure it out will be to have the link to Odyssey channel for me, and then just at 6 o'clock, just refresh it and you'll see, at least that's what I understand from their email to me, that this is how it will work. You would see that there is a live show and then you would join. So we'll figure it out. Generally on the YouTube side, my channel, of course, so I took down some videos were taken down by YouTube. The end result is that Dr. Bean channel on YouTube, they have this message there, publishing fewer videos. So I'm not publishing fewer videos. I had to take down some videos and they took down some videos. Publishing fewer videos is causing your channel views to be lowered, but the ones you uploaded recently are performing better. So the difference is that from about 150,000 video views or 200,000 video views per 48 hours, now they're down to 50,000 views per 48 hours. So 1/3 of the performance is gone. Here in the real time, I used to see 200 to 300,000 views, and now there are 116,000 views in 48 hours. So all YouTube stats have gone down. And again, there are people who are actively trying to shut us down, who are reporting videos, who are complaining, who are sending complaints to YouTube, who are sending complaints to other agencies. So it is not just YouTube just woke up and decided to bring down Dr. Bean. It is people who are reporting and who are complaining, and they are just on a mission to bring it down. So we are on a mission to continue. They are on a mission to bring it down. We'll see. Okay, so let's see what's next. Kelly says, I hope your viewership rises again. Thank you. And hopefully the way I look at it is that I would just want to continue to serve. So if YouTube channel goes down, then hopefully Odyssey would continue to support our discourse. If they would bring us down, then we'll go somewhere else. So I think it's the discourse, it's the discussion that should continue. Okay, so Carolyn is saying, Carolyn, I'm also not sure why Dr. Patterson thinks that the finding of S1 in the monocyte means that the monocyte aren't self-destructing properly. Instead of that, there is a virus hiding out somewhere and continuing to produce new debris. The problem with this persistent virus is that so far, persistent virus has not been found. This has been found that from the GIT, after 2 months of the recovery from the virus from symptomatic and PCR, there is still virus broken particles in fecal matter. So it is possible that it is hiding somewhere. So far, there have not been the tissues isolated where viable virus is sitting. And because of that, most of the researchers would say, okay, we think there is no viable virus. Now what is out there? Secondly, when they looked at the monocytes protein, so Dr. Patterson joined my channel once, and he shared the graphs. And if you see here, the only protein they could detect was S1. They were not able to detect other proteins. So there are multiple factors that make them think it is S1. Changing my view. And here is a good news. I actually have the Luffy cam now active as well. So let me show you Luffy cam. So please bear with me because it's going to be a totally different camera setup. So here it is. So the thing is this, now both cameras can be active at the same time. So I could continue with this one, and the Luffy cam could be trained down there towards the Luffy. So I'm going to set that up tomorrow. It says the mouse's clicks are bothering me and the keyboard, so I have to change them as well. Samina says, question, in BD, ivermectin plus telemedicine services by our government free for all 24/7. So in Bangladesh, ivermectin plus telemedicine services by our government is free for all 24. Wow, that's some progressive thinking, considering that ivermectin's name is banned, or saying ivermectin can be useful is banned in majority of these countries. Having ivermectin plus telemedicine service free for all sounds like a first world country, and we are sitting somewhere with the less developed countries. That's impressive. So Andrew Brady says, hello, Dr. Bean. Won't ACE2 reduction cause pro-inflammatory reaction regarding the mechanism of action of the drug in the last video due to the imbalance in the ACE1 and ACE2? So yes, ACE2 needs to work with the in balance with ACE. But the problem here is an imbalance of ACE stimulation or presence for SARS-CoV-2. So now the problem is, if we can generally reduce the infection, then the idea of inflammation is a secondary aspect. Inflammation is after the tissue damage by infection. So if we have reduced the infection, maybe just retained it in our nasopharyngeal area, then generally we are doing better, even if the inflammation here is slightly different. But when the virus continues to attack the cells, break them, go and infect them, make more viruses go into the rest of the body, it can cause cytokine storm, and it can cause severe lung injury. So generally that can be reduced. So you are correct from mechanism point of view, but there is a benefit of less virus load. So Rima says, can you please explain how mutations occur? Yes. So this is a sensitive topic as well, because some folks will think that mutation only occurs with the vaccines. This is such a sad thing. Although I am one of the doctors who is so harshly being torn down by some of the folks, but there are doctors who have actively injected this misconception that variants or mutations are only occurring because of vaccines. And there are so many incorrect theories. For example, yesterday when I spoke about it, and this is why I get punished, because I push back and say this is wrong. Yesterday, when I talked about it, that the vaccines, so somebody had asked about the T cell depletion because of vaccines, and I said no. Then there was a comment that what I don't know, Mubin, is that the innate arm will be depleted. These are not little tanks of things, that here is the innate arm, there is a tank in which there are a bunch of cells sitting here, and then somehow the adaptive arm, under the orders of the vaccine, will cause the innate arm to be depleted. I have been saying it, and I know that this causes lots of people to become angry. They report, they cause all kinds of complaints, but this is not correct. The concept of production of variant, first I want to show you, and majority of the cool beans here, they know this. Next strain, my video is on this. Next strain, if we go to coronavirus, what happened to there? So this is next strain. I read it almost every time when we have this discussion. Even then, somehow me being the messenger is is the one who is at fault. Here, if you read this, although this is kind of a little less, it's small and gray, there are millions of complete SARS-CoV-2 genomes available, millions they're saying, and we are talking 18 months. We are not talking only after the vaccines. And I'll show you why I am correct there. Millions of genomes are available, and then they're saying we are only showing a smaller number. So if you see here, go down to this one. This is here. This is 2019, 12/26, December 26 of 2019. This is the Wuhan version. And now just start following here. And there are no vaccines during the April time and May and June and July and August. And do you see all of these variants? And then September, October, all of that. And there are more variants here, totally understandable. Now, it is not that here the vaccines were introduced and that is why the variants are appearing. If that was the case, then the variants would emerge by tons from Israel, from US populations that are, a lot of the people are uh, vaccinated. So the question of variation and how these mutants are produced. So I know that there will be once again a response to say, you don't understand the selection pressure. And I do understand the selection pressure. So here is how the variation occurs. Whenever a virus enters our body and eventually into our cell. So here is a cell, here is the virus mRNA. If I increase the size of this mRNA to show us here, let's say this is the mRNA. mRNA has, messenger RNA has amino acids on it. These amino acid have various combinations. And it is possible sometimes. So let's say three of them, these three, will together make or code a brick that looks like this. So it's even below the amino acid, right? These are nucleotides and nucleosides. So genetic bases. Three of these bases, they get together to code an amino acid. Now it is sometimes possible that this, let's say this is the base is A, B, and C. These three combined, wherever you'll see ABC, that makes amino acid, let's say amino acid T. This is T. Now, sometimes in mutations, it is possible that ABC becomes changed to AAC, for example. And that combination still makes T. This is a silent mutation. Mutation occurred, but the amino acid is still the same amino acid. The brick produced is still the same brick, even when the raw material was slightly changed. This is a silent mutation. Normally, it doesn't cause too much of an effect. But then there is a possibility that, let's say, it becomes A, B, and B. And now this change in bases might actually become a code for a different amino acid. Let's say this is Z. Now the question becomes that when the viral proteins are produced, this particular change that occurred, and I know, Rimal, you said talk about the change itself. We'll go there, but let me explain why virus can continue to work by these changes. So let's say now in place of T in the bricks in the amino acids, let's say there was T here and T here and B brick here and C here. And now in a new daughter virus, there is T and B and Z and C. And it is possible that just this one tiny change has no effect, and that particular protein that will be made from this amino acid pattern is able to continue to do its function. There may be a slight looseness somewhere, but maybe it is just compatible with the overall protein function and protein would continue to work. That means this virus will be fine. And these kind of mutations occur in us as well. But it is also possible that some mutation occurs where this amino acid becomes changed favoring the virus. And that is that it imparts, or this amino acid or a bunch of amino acids, they change in such a way that there is a capability inferred on the virus that it can do, let's say, better binding, or it can kill better, or it could do something more efficiently. Now, this is also possible that this change will actually result in the virus being less efficient and disabled. So that means when the mutations occur, again, Rima, I know that you said how do they occur, and I'm saying when they occur. So I'll go back to how in a second. So when the mutations occur, it is possible that the daughter will be the same as the parent, or the daughter will be not same as the parent, and it is kind of disabled. It's not going to be able to do its function, and it would die. Or the daughter is even more efficient compared to their parent, and this, because it is more efficient, this would gain hold. It would get, all of these daughters may actually be shed, but this daughter that is more efficient might win over the other ones, and then it would start propagating. That is, for example, delta. This is a common normal mechanism, happens in everyone who is infected. So saying that only unvaccinated will be this way, or only vaccinated will be this way, or somehow vaccinated would have a higher ratio of the mutations produced because there is more selection pressure in them versus unvaccinated, or to say the other way as well, that unvaccinated are creating more variants than vaccinated. Look, unvaccinated are getting infected more. That means the if you stand 10 vaccinated and 10 unvaccinated folks will be infected for a longer period of time till their body takes care of the situation, or if unfortunately they die from it. And during that time, more mutations and more variations would continue to shed. In vaccinated person, the shedding would probably occur for a couple of days before, in a normal healthy vaccinated person, before the immune system takes over. In a unhealthy, less healthy, at risk vaccinated person, or let's say immunocompromised vaccinated person, they might continue to stay sick for a longer time and continue to shed longer time and more mutants as well, just like unvaccinated. So that is that there is not really, if at all we want to say, tell us who will shed more variants, it will be unvaccinated who would shed more variant. And the reason is not that there is something to do with the vaccine, it's a window of time during which virus is replicating in them. In a vaccinated person, the window of time for which the virus is going to replicate is a couple of days. In an unvaccinated person, this would be a longer period of time. Again, we are seeing that even vaccinated who are at risk are infected for a longer period of time, and they would have the same behavior, or the virus would have the same behavior in them as unvaccinated. Now the question is, before I go to why this happens, one more important thing for SARS-CoV-2, and that is SARS-CoV-2 has a proofreader enzyme as well. So whenever a copy of the genetic material is made, so generally how this virus is, how it is built is, various proteins are built for the virus. Those proteins are assembled together. Then a brain is put in them, that is the genetic messenger RNA piece. And then this assembled protein and this messenger RNA piece is asked to leave. And when it is leaving our Golgi apparatus and the endoplasmic reticulum, it would steal a piece of our vesicles membrane that would become the virus's membrane. This is how it is built. So every virus generally is given a brain. That brain is this messenger RNA. So when the brain is being built, that is a copy of the messenger RNA is happening, the proofreader enzyme would continue to proofread and try to figure out if there are mutations. And if there are mutations, it would try to fix them, and either the mutations will be fixed or the messenger RNA will be destroyed. And in some cases, as we can see, the proofreading will miss the proofreading and a variation will escape. Interestingly, if there was no proofreader, this virus would have much more mutations than what it does now. It doesn't have mutations like flu virus has. It has lesser mutations. It is deadly for us because we have never had this virus in us before. Number one. Number two, this virus causes cytokine storm, which is a different mechanism than flu. So even when its mutations are less, even the original version, Wuhan version, was deadly enough that it started killing people. If it was not lethal and it was just a pandemic that everybody had cold for a few days and then they became okay, I think the world will not be in lockdown. So right from the beginning, this virus has been deadly and it has been mutating. Now the question is, why does the mutation occur? So Rima, the mutation usually is not a planned process. It is that when the new messenger RNA is being built, what happens are there are enzymes that are sitting. These are called polymerases. Polymerases. For example, RDRP, RNA dependent RNA polymerase. This is an enzyme which we've been talking about for this virus for a long time. This enzyme is a target for many drugs. So RDRP will pick up the the bases, the nucleotides, and nucleosides. It would pick up those bases and it would construct the new messenger RNA or the genetic material. It can sometimes pick up an incorrect base and attach it. That is how a mutation can occur. Now, this guy, the RDRP, tries its best to correctly attach the right base, but it can incorrectly attach a base. And it does not have the capability to turn around and say, sorry, I put in the wrong brick, I need to remove it. It is the proofreader's job to come and check that brick that has been placed and see if it is correct or not. And as we can tell, SARS-CoV-2's proofreader is not the best proofreader in the world. That is why the mutations continue to occur, variations continue to escape. That is how it happens. So Thrill has a very interesting question. Will suppression of TMPRSS2 positively affect flu, cold, and maybe cancer as well? Don't know. So the basic idea is wherever TMPRSS2 is used for priming and then usage of that virus attachment, then it can be useful. I have not heard of TMPRSS2 to be affecting the flu or other viruses or to helping to prime them, and that may be just my lack of knowledge. Uh, Tiago Emerald says, is the community, so they gave this name from community Pfizer vaccine different than the uh, BioNTech? I heard some doctors mentioning the one that has been approved by the FDA is a previous one and not the new one. I thought that BioNTech Pfizer have not created a new one. It is the same one. So what happens is what happened was that BioNTech actually created the vaccine, and then they were a small company. Now they're not a small company, they're big, but at that time they were a small company. They didn't have the platform to manufacture and distribute, so they struck a deal with Pfizer to say, you become our platform, and that is how it became Pfizer BioNTech. And my understanding is that so far this vaccine is targeted at the original Wuhan version messenger RNA, or the spike protein that was there. Now, I do not know, and it will be a big deal if it happened and I did not know, it would be a big deal for me as well. And that is that, did they actually release a new vaccine variation for Delta? I didn't think that they did it. So it's the same vaccine. They just named it for whatever, for fun. Is this love? Yeah, says anti-vaccine people will get natural infection as normal. I don't know what does that mean. Um, Emily Sholem says, if on ivermectin for COVID, would the reduction of viral replication reduce the opportunity for mutation? No. So of course, if in somebody in one day there are 1 billion viruses made versus in another person in one day 1 million viruses are made, then of course compared to each other, the number of mutations possible are going to be drastically different. So it is really not the ivermectin's role to reduce the variation, but the viral number of viral copies created are less, and so that would reduce it. So in a way, you're correct. Okay, so Iron says, I loved the video you made called Ivermectin Works Against SARS-CoV-2, shared it with all my friends and family. I noticed that YouTube recently took it down. Where can I find it? So on Odyssey. So if you go to Odyssey, and on Odyssey, if you go to my channel, here is the channel. So in this channel, you can find these. I don't know if there is a way to search here. So if I said ivermectin, I hope the search is within my channel. It seems to be. And I think all of the ivermectin videos are here, including this video that got me the first permanent community strike. So if I get 2 more strikes in 90 days, my channel will be permanently stopped, this YouTube channel. So Iron, here are all the videos that you can see. I had to bring them down on YouTube. That's unfortunate, but this is Kyrie. Skyfrog says Odyssey has the banned videos. Yes. So far, I don't know if at some point Odyssey is going to turn on us as well, but so far Odyssey has them. TD, YouTube's loss if they cancel Drbeen. Yeah, so they said if this happens again, then the rule is that 3 strikes and you're permanently gone. Becky says all the pharmacies in the Mount View Los Altos area have stopped filling prescription for lufumectin. Any recommendations or pharmacies for those of us who live in this area? So a couple of things. One, I could not get ivermectin either. They just simply said we don't have enough quantity. And so this was CVS. I heard that Walgreens is still doing it, and I heard that compounding pharmacies are still doing it. So it looks like there is an issue. Unfortunate. Michael says, regarding myocarditis or pericarditis post messenger RNA vaccines, any reason to believe that these are just the symptomatic cases and the damage being caused even to those not showing symptoms, tip of iceberg? So at least for the cardiac inflammation, so in theory, it is possible that there is some inflammation and we are not even aware of it. It was so tiny. If that is the case, then body would not even care, and so that's why it did not inform you, and it would just resolve. But if this is something that is going to be serious, then we are going to have the symptoms and we are going to end up in a hospital and we would need treatment. So Frankentronic says, if a vaccinated person gets infected with SARS-CoV-2, does that infection act like a booster? Yes, but please realize that vaccinated people getting infected are dying as well. So it is just a very, very dangerous thing. But from a mechanism point of view, yes. John says, I had to pay 1,300 yuan, 1,300 for ivermectin. Did you use GoodRx? That should have helped. Ivermectin study in UK, when we get the results? Not yet, I think. Okay, so Kelly says, great question. Where is it? What is the question? So Rima says, so each replication is a potential mutation. Yes. So every DNA copy could have mutations in it, every copy. And then there are some mutations that would be silent. Then there are some mutations that would actually be drastically bad. Some are going to be helping. So if you actually look at type of mutations, you will come across, again, without stepping on some folks' copyrighted material. But if you just look at that, you would see that there are going to be mutations that can be silent. So frame shift mutation, silent mutation, missense mutation, nonsense mutation, and so on. The frame shift mutation is, so if I go here for a second, frame shift is that, let's say we have a genetic material that is A, B, C, A, B, C, and then A, B, C, C, A. So one amino acid, second amino acid, normally three bases make for an amino acid, and fourth amino. 1, 2, 3, 4 amino acid are coded here. Now imagine if ABC is coding an amino acid, let's say T. I'm just making up some T, some number, some letter. Then if you see here, this is AAB, correct? If I delete one A from here, that would cause the whole genetic material to shift because there is a deletion here. So it will become, so here, let's say the deletion occurred here, then the new genetic material from here onwards will be A, B, C, then C, A, and there is nothing here. This got frame shifted, and let's say this AAB was some Z amino acid. When this frame shift occurred, now it has become ABC, and that is a T amino acid. So all of a sudden the amino acid changed. Now the last one could be a damaged amino acid, which may cause this whole protein string to be damaged. So these are frame shift, and then we have missense and nonsense and so on. So as you saw, there are multiple kinds of changes. So these changes can occur with every messenger RNA copy, DNA copy. Ideally, then proofreaders will come in and proofread it and correct it. If they cannot correct it, they would destroy it. If they cannot correct it and cannot destroy it, that would become a new copy with a new variant. And that variant would now, it would depend. If that variant has become disabled, then it's going to go away. If it has become more efficient, let's say it became more lethal, then it's going to start killing people. And that would reduce its circle of influence. If it is more efficient in terms of spread but less lethal, then it would continue to start spreading more, like Delta is. In theory, Delta should be less lethal, and if it is more contagious. But of course, we are talking SARS-CoV-2, which generally is a lethal thing. So DC Thomas says, why doesn't Biden give everyone a free daily supply of nearly instant in-home saliva tests and mandate being COVID-free to enter work, etc., free in UK? So you know that there are many things that can be done other than just pushing in one direction. So Nicole says, are we possibly experiencing ADE with these vaccines? Why so many breakthrough infections? So Nicole, number one, no. And then the question of why so many breakthrough infections. I have discussed this in the past. Let me just very quickly review this. There are a couple of ways to look at what is a breakthrough infection. If we say that here is a vaccine or there was an infection, and the result of that is that immune system has become trained and kind of ready to fight with the infection to reoccur. So let's say this immune system learned that the spike protein's structure is, I'm making up a structure. So let's say this is a SARS-CoV-2, and the original version of SARS-CoV-2 had this form of the spike protein. And this immune system learned to bind with this structure of the spike protein and work with it. Now imagine this virus arrives, the same structure, the same pattern virus arrives in our body where this immune system was trained. Then very easily immune system would produce antibodies. It would take, in some people, 10 hours, some people 24 hours, some people 48 hours. I suspect in some people even more delayed. But normally their immune system is trained, but it will take a few hours or days to become active again. So these memory cells, copies of these cells will be made. That is called proliferation. Then the affinity maturation would occur, differentiation would occur. They would become an army and they would attack the intruder. And this would happen within 1 to 2 days. And so for 1 to 2 days, this virus in this person could continue to shed because the virus could actually cause infection during this time. And will it always cause infection? I have done this discussion in the past as well, that it depends when did they get vaccinated or got infected, and what is their immune system's current behavior? Where are the antibodies at this time? If the antibodies are settled, let's say 4, 5, 6 months after, then it would take a couple of days for the immune system to rev up. And during that time, virus is not going to wait to say, okay, fine, you know what, I'm going to play fair with you. I am going to wait for your immune system to get up to speed. Then I will start trying to infect and we'll have a fight. Virus is going to say, oh, good, immune system is sleeping. I can do as much destruction as I want. So that is defined as breakthrough in CDC's measurement. The actual breakthrough, that will be, in my books, the dangerous breakthrough, the actual escape, will be if this virus arrives in our body in the future. We trained our immune system here by the infection or by the vaccine. And I hope we never ever trained our immune system intentionally with the infection. That is very dangerous. So now let's say here is the 3-4 months later, the virus arrives in this person's body again, but the virus has totally changed its spike protein differently now. It is this way. So now what will happen is that this immune system is going to try to proliferate and start making antibodies of this kind against this structure, and that is not going to work. And if that is not going to work, this virus is going to become very, very happy and it's going to start infecting us. This is a true escape. This is a true breakthrough, that the immunity has been defeated. It is not defeated because the innate arm got depleted, or it is not defeated because somehow the virus decided to destroy cytotoxic T cells. Unless this virus changes to become an HIV like virus to do these things, which it has not done. So these are wrong concepts. The right concept will be the virus has changed so much that our previous antibodies cannot recognize it. If they cannot recognize it, is the person who was previously infected or previously vaccinated in trouble? Will they now never be able to handle this virus? Not at all. Do you know why? Because now this virus that has arrived in our body, and that is a new type of virus, our body would just take it as a new type and start working on it. So once again, it would take 2 to 3 weeks for us to handle it. In that process, some of us will not be able to handle it correctly and die. At least with this virus, that is the unfortunate part. But we will handle it just like we handle today, and that will be the SARS-CoV-3. The rumor or the myth that has been created, there are so many layers of myths and incorrect concepts that have been created. And I keep repeating it. When I try to present that this is not how it is, I become the target. But here, there is an additional rumor or myth that is in the market, and that is the following. When the virus arrives, a virus that has a change which will not allow the currently trained antibodies to attach with this, what they will do is these antibodies, they will weakly attach here. And now they will be called leaky antibodies. And now the immune system would say, well, I did my job. I tried to attack this. I very quickly, rapidly got up to speed within 2 days. And I have made my antibodies. I have released them. Their job is to go now fight with this virus. And I'm not going to make more antibodies. I'm done. And if these antibodies are not able to work with this virus, then so be it. I don't care. This is the antibody and this is the immune system. Immune system will decide not to make more antibodies of more specificity to this new variant. This is the other, I don't know what to call it, other concept that has been propagated. The problem is that immune system doesn't do this. Immune system doesn't, so let me back up. There are people's immune systems that do not behave correctly in general. And we know that in some people's immune system, for example, if their humoral arm had to be connected, their cytotoxic arm becomes connected. And now that is an incorrect behavior and the person actually gets a disease. Or the cytotoxic arm needed to be connected and they responded with the humoral arm and now they are in trouble. Or the innate arm, the neutrophils had to work better and the neutrophils are not working correctly because they cannot do the oxygen burst in them because of some genetic problems, and that immune system cannot handle the virus or bacteria correctly, creating the non-granulomatous diseases. So I am talking about the healthy people. In healthy people, if the immune system encounters a pathogen and the previous antibodies are not going to work against it, immune system is going to make new antibodies. It would now take 2-3 weeks then. There would be a risk of the person dying just with the natural infection as well. Imagine this as the natural infection occurred again. This will be a true breakthrough. But just after the vaccine, getting symptoms, when that is defined as breakthrough, then yes, we can all have breakthrough even after vaccination. And I have said it many times before. I would, just for completion's sake, I'll put it over here. And that is, imagine vaccine was here. Here, this is point A. After the vaccination, and I'm talking about complete vaccination, so that is 2 doses and 14 days. So here we are, and healthy person. So now they have enough IgG in their body. And this would stay on for some time, 5 months, 6 months, 3 months. Everybody has a different window. And then these antibodies will go down, they will wane. And that is also a normal process. The cells will become memory cells, the active cells will be destroyed, or they'll do apoptosis. So the antibody production will be less. Now, in this person, if the re-exposure occurs when the antibodies are more, IgA is present, IgG is present, the T cells are working and present, cytotoxic T cells, the whole system is up and running, and then the exposure occurs again, they might not even know that this happened. They might just get tiny bit of a fever or some symptoms and just not even realize that they got the virus. On the other hand, when the waning has occurred, then their immune system needs to rev back up. And during that time, if the exposure occurs, then there could be symptoms. So really, there are so many parameters that need to be looked at to create a generalized statement to say, can there be breakthrough? When can there be a breakthrough? What does breakthrough means? And so on. I would put it in a simpler term for us. Those who have become vaccinated or had the infection before, and their immune system is ready and they are healthy, and immune system did not misbehave when they were infected or vaccinated, then their chances of severe diseases and death are drastically reduced. Everything else, the symptoms can appear, the infection can happen, and so on. Okay, so Doug says it's time like this that you need to have your questions answered, not much time for others. Okay, so tell me, Doug, did I miss somebody's question? So somebody is saying, why are all Vashna comments are disappearing? I don't know. I am just busy. Skyfrog says, when will you see more of your artwork on Art Showcase? So I will start again soon. Truth be told, with all of these pressures, so I was people's complaints going to my college, complaints going to my professors, complaints going to my friends, various kind of threats of various intensities, then complaints to the local agencies, then continuing to teach and finding the newer material and drawing. My teaching has an additional facet to it that I have to sit down and understand what to present and then draw it and illustrate it. And so all that needs a lot of attention in all of these, and then doing my business as well. So I could not find enough focus and time over the weekends to do my artwork. So that was the real shame of this whole thing, that I could not do my artwork, which I love to do. So hopefully I'll start soon. Thank you for asking. John Titer says, I know you've said that the spike protein is likely not cytotoxic in the past. Do you still think that's still the case? I know some FLCC folks seem to think otherwise. So even when you go and look at my video about is spike protein cytotoxic, I think there are multiple things that are being conflated. and then said that I say it is not cytotoxic. Let me explain this. And I have been discussing this with multiple folks. So let me see if I can explain what I have been meaning. So first, there is a study, and I have discussed that study. There is a study that says when a spike protein attaches with an ACE2 receptor. Now that spike protein is attached to the virus or not doesn't matter. When it binds with the ACE2 receptor, it can cause cytotoxicity in multiple ways. What are those ways? Number one, just binding, occupying the receptor causes imbalance of ACE1 and ACE2, just like a cool bean asked that question today. This imbalance of ACE1 versus ACE2 causes the pro-inflammatory system to become more active, which will then, if the inflammation occurs here, then this cell is in trouble. Let's call that cytotoxicity. Another possibility is that when the spike protein binds here, without entering the cell, the ACE2's signaling mechanism can cause reduction in nitric oxide production, for example. This is also anti-inflammatory behavior. We have discussed this many times. Now, ACE2's function is to help produce more nitric oxide to allow the blood vessels to relax and the inflammation to reduce. But when the nitric oxide production is reduced, because that is a signaling mechanism of ACE2, we know that from 1.5 years ago. I have discussed it. And what would happen is this cell will not be able to protect itself from the inflammatory attacks or from the damage from the reactive oxygen species, and the cell will get destroyed. When that would get destroyed or can potentially be destroyed, then the broken cell pieces will cause local macrophages and neutrophils to eat up these things, dendritic cells to eat up these things, and start releasing cytokines and start inflammatory process. So not only this cell will be in trouble, the local area would get inflamed. If that is a blood vessel, there could be a damage to the blood vessel. So is this a mechanism that is doable? Yes, doable. Then there are other signaling pathways from ACE2 that can also cause cell to not protect itself correctly. All of those mechanisms together can be called cytotoxic. And I have discussed them. I have discussed them when I talked about cytokine storm. I discussed the ACE2, ACE1 imbalances before. I have discussed nitric oxide before. I have actually discussed, I think no one on the internet, you take Campbell or you take Medcram or you take ZDog or you take somebody else, no one has explained the mechanism of pro and anti-inflammatory in detail as I have done. And that all is related to ACE2 occupation by the spike protein, regardless of spike protein being attached to SARS-CoV-2 or not. So this is the basic understanding, and I think I was clear on it. The problem was when I talked about the Pfizer study. So I can actually count the studies that have brought heat and are still bringing heat to me. That study, the Pfizer study, which said it was not really a study. It was the Pfizer ADME document for parts of the lipid nanoparticle, the newer parts of the lipid nanoparticle, and they wanted to see where do these parts go and how are they metabolized. This is the job of a pharmaceutical company, to inform us tomorrow, to write those things in the books, to say, hey, this product of ours has following components. Those components are, when administered from the following route, Here is the first pass metabolism that occurs to them. Here is the modifications that occur to them. They would distribute to following tissues. Inside the tissues, they would be eliminated in following ways. Then finally, they'll be eliminated from the body in this much time, either through the fecal route or the urinary route or through the respiration or through saliva or whatever. There are various kind of ways drugs are eliminated. Majority of them fecal or urinary and then sometimes breath as well. Some drugs would cause a change in the breath, or sometimes distaste in the mouth is actually they are secreting in saliva and so on. It is their job to inform us so that tomorrow these things would become part of the books. Some folks had taken that document and said, this document proves that spike proteins will go to ovary and other places. And then they said, we also know that spike protein is cytotoxic. So hence the conclusion is that giving the vaccines will cause cytotoxicity, would cause cytotoxicity, will cause infertility, will cause tissue damage, will cause a bunch of damages. I clarified in that study's review that is spike protein cytotoxic? Is this study saying that? And I clarified that that study is actually not talking about spike protein. It is talking about lipid nanoparticle, and the lipid nanoparticle, not all of it, two components of it. And I said those two components are lipid components, and they have found where they will go, where they will travel to and be removed from our body, and how they'll be removed, and when they would be removed. That was the discussion in that video. There were so many comments afterwards. Some said that wherever the lipid nanoparticles component will go, that is where the messenger RNA would go. That's not true. A component, when this lipid nanoparticle enters a cell, so let's say it is here in the cell, it is going to be broken down in the cell, and the messenger RNA would be brought out. Now, this messenger RNA, when out of the lipid nanoparticle, is not going to get out. This is why we encapsulated it in the lipid nanoparticle to move it in. Once it is in and it has given off its messenger RNA, that messenger RNA cannot get out. And the lipid nanoparticle would only give off the messenger RNA like an egg when you break the egg. You can't get the yolk out of an egg without breaking the egg. The lipid nanoparticle, the lipids are the shell of the egg. The messenger RNA is inside the yolk and ovary, or whatever, what is that? Yolk and white. So when you break the lipid nanoparticle, some pieces we know what happens to them. For other pieces, they did not know, and they said, fine, they'll get out. We are going to observe them. We'll make them radioluminance, and we will observe where do they go. And they observed them. And they would go to various tissues, including ovaries and liver and other parts, and then they would be eliminated there. These are lipids, they're like cholesterols. They would be removed. That is a discussion I had done. And that discussion I think that is a price to pay for talking about COVID, because COVID is not just medicine, it is belief system now attached to it as well. And whenever I talk about some concept, I talk from a medical point of view, and I don't take a leaning, I don't take a bias, I don't take a position to say this is a Republican position or a Democratic position or a person who likes vaccines position or a person who does not like a vaccines position. I take a medical position, and that is, I think nowadays it is kind of unique. Many people have their own groups, and I sometimes feel nowadays with all the hammering that goes on to think maybe I should have just taken a position and just be in that group. Anyways, so this is not the point that I have said Spike protein is not cytotoxic. And then there was another part of this which got me all that heat, and that was the following. I had said that spike protein will not escape from the area of injection and distribute in the body in tons of concentration. And just like some doctors said, that it would actually go and modify the genes and DNAs and become part of our cells everywhere, and even would come from this deltoid. Somehow the spike protein would find its way into our throat, then be secreted here, then be shed from here. And I had said that's not going to happen, which also got taken as Mubin says spike is not cytotoxic. I said spike is not going to go. It could cause local damage, and that is what we see. And even that damage is intentional, that we are causing immune system to be revved up. So the damage is really more of an immune system triggering. In that process, there is going to be local damage. That is what causes pain and fever and local hurt. But it's not. If the spike protein was just going everywhere in the body, causing generalized vasculitis, people would just start dying after vaccines. And of course, then when I say this, the comments come, do you not know that there are people dying in mass numbers? So I think I cannot explain it for everybody's comfort, but the end result is that whoever is unhappy, they then just take a position and start attacking me. Okay, so let's, and this attack is not just people. YouTube does it too. What is that? The Twitter blocks things too. So there are multiple dimensions that are that this is happening, and this is why I have been saying it very often in the past. It is the medical leadership whose job was to take people in confidence and to explain these mechanisms, provide information, provide helpful talks, provide weekly, daily messages. I am sure people will be all ears if there were information coming from CDCs, FDAs, WHOs that are useful, caring information. And in the lack of that, in the absence of that, people talked, and then it became people's issues to sort out who is right and who is not. And one unfortunate outcome has been that people are just, from every group is saying, I am right. And then they feel necessary to go and attack the other group. Okay, so Doug says Tamil Nadu and Uttar Pradesh. So Doug, I could not find that data today or collect that data today because I was working on this OBS and all this. So give me another day and I will pull that data together. K. Molier says, please address the super chat. I have no idea. The super chats came and went. My apologies. Let's see if I can find them. Otherwise, whoever wrote the super chats, please write them again. So there is one I found. Richard Moore says, have you looked at COVID-19india.org for data in Tamil Nadu and Uttar Pradesh? Send some charts to your Twitter. Sorry if you answered this. I'm in Laos, so time difference. Value your work. Many thanks. Thank you very much. I am going to go there right now. But I want to make sure that without wasting your time, I look at it separately as well. COVID-19india.org. Yep. I think this is the one I used to share with. This is the one Dr. Asia had sent me. Yeah, so Maharashtra and wow, black theme. I like the theme. So give me a day. I wanted to make sure that androgens are done and anti-androgens are discussed and their relationship to COVID. There are still some more studies with anti-androgens. Maybe we should talk about them if you're okay tomorrow, and then I'll look into this as well. Be kind and happy says. So why do I chuckle at these questions? Because when I answer these questions, these become the reasons that I then get folks who become upset. So why does CDC says an unvaccinated person is protected for 3 months after an infection, but a vaccinated person is protected longer? Everyone has studies to show for what they want to say. I had discussed a study which showed that natural infection would also create bone marrow plasma blasts, which would live on for longer period of time. So let me explain what it means. And this was with the natural infection. I'm sure it is with vaccine too and with natural infection too. This is why I actually don't have to take a position. These are medical concepts. So if there is a group that is, let's say, no vaccine, there is another group that says yes vaccine. There is a middle ground here that says medicine. It would agree here for some times, for some things. It will agree here for some things. It will disagree here for some things and disagree here for some things, because this is the medicine. So now going to your question, there was a study that I discussed. In that study, what they said was, so now I'm referring to that study. What they said was, imagine there is an infection somewhere or vaccine. So let's say, let's take two people. Vaccinated person, this is deltoid muscle of the vaccinated. And let's say another person who was infected, and this is their throat. And they have infection here, nasopharyngeal area. They said that when the immune system responds, the memory cells that are produced, they live in three places. They can live in three places. One is immediate vicinity of where the infection or the antigenic trigger occurred. So in case of, for example, deltoid, maybe there is some memory cell in deltoid, but I would doubt they would sit there. In the throat area, there are many memory cells and lots of lymphoid tissue, because our body is very concerned in this area. Not only the air is moving in and out, and especially when it goes in, it can bring in pathogens. We eat food as well, and we put things in our mouth, and these can have pathogens on them. So our body is very careful for nasopharyngeal areas. And so there is a huge concentration of lymphoid tissue to protect us, lots of guards. So now one set of memory cells can live where the infection occurred. The other set of memory cells will live in the nearby lymph nodes. And we have lymph nodes almost everywhere in our body, right? So nearby lymph nodes will have memory cells in there as well. So here with the deltoid, nearby lymph nodes in the chest area, in the cervical area, in the neck area. Then they said a third population. Sorry, so let me add one more population before go to the third one. Then they said that there will be memory cells and active cell that would enter the blood vessels as well, and they would circulate in here. These are the cells that the T-detect test, for example, can figure it out from blood. Why are these memory cells sitting in the blood? Because they circulate in the blood as well. So now location of the tissue infection, 1, lymph node 2, circulation 3. Then they said that there is a 4th place where sometimes memory cells go and live. Not all infections memory cells live there. Some infections memory cell can go and live in the so let's say this is the I always crack up at my drawing of the bones. I'm trying to figure out how these bones look like. So femur, sorry, this is a bad femur. It has a disease. So here is a femur, and there is, let's say, bone marrow. Bone marrow, normally vertebral bone marrow or clavicle or sternum. In the bone marrow, sometimes the memory cells will go and live there as well. These will be called bone marrow plasma blasts. And you can Google them, bone marrow plasma blasts. These are memory cells that have moved to bone marrow to live there, and they can live there for decades. That means they can confer immunity to a person for a long time. And the study researchers had found that after the natural infection, they found the plasma blasts living in bone marrow as well. From where they concluded that because long-term immunity memory cells live in the bone marrow, there must be long-term immunity because of the natural infection as well. And I think they are correct in that assumption. That means there are studies that show that long-term immunity is possible after infection. There are studies that show there can be long-term immunity after vaccines as well, although vaccines are newer and their observation of their effects and their protection is not long-term yet. But still, if, let's say, vaccine-induced memory cells go and start living in the bone marrow, we could say, hey, this will be long-term immunity. So now when I'll conclude this remark to say, this simply means it's not necessary that CDC is correct in saying that the long-term immunity is only possible with the vaccine. This is what brings heat to me. Because people say, how dare you say things that don't go with CDC? But really, this is medicine. And I have done this study. The best way to attack me back is to go look at the study. I am not sitting here making science. I am one of the least important person, and that is I just present what others have done. I don't even have something useful to add other than what others have done and to illustrate that. And so we should go and prove that those studies are wrong. Then that would be correct to say, hey, Mubin presented this study. That study was actually incorrect. So Mubin's messaging was incorrect as well, or proved to be incorrect. And I'm okay with that. Okay, so with this, let's stop for today. We are at 8 o'clock. Thank you very much for being here. Thank you very much for your time, for your presence. You increase the ambience of Dr. Bean's talks, and I would see you tomorrow. Thank you very much for sticking around with the OBS testing as well. Please do me a favor. Please like, subscribe, and share. Not only the viewership went down 1/4 to 1/4, of course, any revenue attached with that went down to 1/4 as well. So, but that is a secondary thing. If you would like to support this work, there are links in the description. One is to buy me a coffee. You don't need to have a PayPal for that, or you can use PayPal, or you can be a patron. Thank you very much, and I would see you tomorrow.